In 1998, the measles virus was declared eliminated in Canada, and reported cases were typically associated with travel. But things have changed. More than 550 measles cases have been reported in Ontario so far this year. How did this happen, and how concerned should we be? Let's dig in with Dr. Jessica Hopkins. She is Vice President and Chief of Communicable Disease Control for Public Health Ontario. And thanks for making the trip up to our studio today.
Thanks for having me here.
When you get the measles, what happens?
Yeah, so the measles is a respiratory virus, and so it passes between people. And initially when it starts, it kind of looks like other respiratory infections. People can get runny nose, cough, red watery eyes, they get high fever, and then they get that typical rash that starts on the face and goes down the body. And it's something we're concerned about because it can actually be quite severe. So certain people can go on to develop things like pneumonia, they can get ear infections, and a very small number of people can actually die from it.
You can die from the measles?
Yeah.
Do you die from measles, or do you die from whatever the measles leads to?
Yeah, so you can die from measles. It can cause brain inflammation.
Sneezing, handshaking, how do you spread it?
Yeah, so it is spread through the air. So sneezing, coughing, it can put it into the air. And one of the things is the measles virus does a really good job of hanging around in the air afterwards. So if someone has measles, they go into a room, it can actually hang out in the air for 2 hours afterwards. The person leaves the room and someone can come in, breathe that in, and get infected. It's one of the most infectious diseases out there.
Okay, that was my next question, which is if you put it on a kind of a top 10 list of other communicable diseases, where does it rank?
It's very high, very near the top. So if, every person who has measles can spread it to more than 10 people. If you put a person with measles in a room of 100 people who are not immune to measles, probably about 90 of them are going to get the disease. It's very infectious.
If those 90 people are wearing masks, does that mean they won't get it?
So in terms of how we're going to stop measles, the best way to do that is really vaccination. Masking can play a role, particularly in healthcare settings, but because it hangs out in the air, typically you're going to need a really well-fitting respirator like an N95 or a KN95, and on a day-to-day basis, that's probably not the best way to prevent measles. Really, the best way is vaccination.
When you were a kid, or do you need another one as an adult, or what?
Yeah, that's a great question. So in Canada, we routinely give children 2 doses of measles vaccine. So they're going to get one usually at about 12 months of age. In Ontario, we give the second dose at 4 to 6 years of age. In 1998, Canada eliminated measles, and as part of that, we started to give people second doses of vaccine. So the key group that probably needs to look into whether or not they need a second dose are those born in 1970 to 1976, because they would have been out of high school when the catch-up was happening, and so would encourage those people to get their second dose, because if you've got 2 doses of measles vaccine, it's better than 98% protective against the disease. It's a really good vaccine.
If you were born in the 60s, 50s, 40s, et cetera, you're in the clear?
So if you were born before 1970, most people will be naturally immune to measles because they got it as a child. But if they know very well that they did not get it, then they could get a measles vaccine.
How do you treat it?
In terms of measles, it's supportive care. There is no specific drug that you can give people. So you're going to treat the symptoms of it, keep people hydrated, watch their fever. If they're more severe and they have pneumonia or brain inflammation, they're going to need a specialist to be able to help advise on their care. But generally, there isn't a specific treatment for it. That's why prevention's the best way to go.
A typical case takes how long to clear?
Yeah, so there's quite a long wait between if you get exposed to measles and you might potentially get measles. So there's kind of 21 days in there that you have to watch to see if you get infected. And then if you get infected, usually it's going to run its course in about a couple weeks' time.
If you're vaccinated, can you conclusively say, I'm in the clear, I don't have to worry about getting it?
Yeah. So, there's never 100% guarantees in life. As I said, the vaccine is really good. It's 98% plus protective for 2 doses. So that means there's going to be a small number of people that get it. And, the information that we have from our outbreak really shows that if you look at the children who are not vaccinated, they make up better than 90% of the cases of measles. So definitely the vaccine is highly protective. It's not 100%, but if you want to prevent measles, that's the best way to go.
We learned from COVID that there are a lot of different pharmaceutical companies that make vaccinations. Is it the same with measles?
So the measles vaccine, there are different manufacturers for it. In Canada, we have the MMR vaccine, so it comes as a combination measles, mumps, and rubella.
I remember that, MMR.
Yes, MMR.
We used to have to take that little thing.
The yellow card?
The yellow card, that's right.
Yeah.
You stuck in your pocket, and
That's
that way you
right.
keep track of
Yeah.
which one of your kids have had their shots.
That's right.
Do all kids who are born in the province of Ontario have to get MMR shots?
So in Ontario, all children should be offered an MMR shot, and then when they enter school, there's going to be a check to see who's up to date. The vast majority of parents decide to vaccinate their children in Ontario, and if they're not vaccinated, it's usually because they haven't made it to their primary care provider to get vaccinated. So that's a chance to catch up. Only a very small number decide not to vaccinate, and so in order to stay in school, you have to show either a reason that you can't be vaccinated, say you have a medical contraindication, or you can do a statement of objection.
Would a religious exemption exist?
That would be part of your statement of exemption.
That would be considered a part of
Yeah.
that. Okay. If, as you tell us, this disease was eliminated, right? Not
That's correct.
eradicated, but
Eliminated.
eliminated in Canada back in 1998, why do we have more than 500 cases of it now?
Yeah, so I think there's a number of different factors that have come together. One of them certainly is the COVID-19 pandemic. So if we look at our uptake of vaccination pre-pandemic, at 7 years of age for measles vaccine, sort of about 86% of children would have their 2 doses at 7 years of age. Public Health Ontario also looked at the 2023-24 school year. So as we've come out of the pandemic, we're at about 70%. And so we've seen a significant drop. And I think in a lot of cases, this has to do with people not being able to easily access healthcare during the pandemic. And so we've got some work to do to catch those children up. I also think we are struggling with things like misinformation, as well as a lot of parents have questions about vaccine. It takes time for them to talk to their healthcare providers to get the information they need to make the decision about vaccinating.
So if I'm hearing you right, vaccine hesitancy brought on by all of what was in the air over COVID may be contributing to the fact that 16% fewer people are getting their measles shots.
Yeah, so vaccine hesitancy definitely plays a role in this, as does, I think, access to healthcare.
Is there ever a good argument for not getting your kids vaccinated?
So from my perspective, I think if you want to protect your children against vaccine-preventable diseases, absolutely, immunizations are the best way to go. They've been around for many years. They are well studied. They are safe. And they protect against some really serious diseases. There are some rare cases where people can't be vaccinated. For example, with measles vaccine, if they are very immunosuppressed, they might not be able to. It's one of the reasons why actually, as Canadians, I think it's really nice for us to all get vaccinated because we can protect those people who can't be vaccinated.
With as many hundreds of cases as you are now dealing with, does that mean we should go back to wearing masks?
So I would not recommend going back to wearing masks on a day-to-day basis to prevent measles vaccine. I would really recommend that people make sure that they are up to date and their children are up to date on measles vaccines.
And adults too?
Adults too, absolutely, especially those born in 1970 to 1976 who might not have been eligible for that catch-up vaccine to get the second dose. If you haven't had a second dose, great idea to get it, especially for people who travel. I mean, we've always recommended the second dose in adulthood for people who travel outside of Canada to countries where measles circulates.
Now, when I got my COVID shots, they kind of knocked me out for a while, right? Like you get the shot and I was in bed for a day.
Okay.
Same thing here with measles?
So generally, the measles vaccine is really well tolerated. I think with any immunization, people can expect their arm's going to be a little sore. Sometimes it can be red afterwards. Occasionally, you'll see sometimes people get a rash afterwards. Anything more serious than that, allergic reactions, very rare. And in fact, kids get these vaccines on a daily basis through their primary care provider. Most within a day go back to doing their usual activities.
Now, I know at least I think I know, when you give out the flu shot every year, you're trying to sort of give your best guess as to what strain of flu is out there right now, and you try to match it
That's
with the
right.
vaccine.
Yeah.
Same principle with measles?
No, the measles vaccine is very stable, and it's the same vaccine that we've been using for a long period of time. It does not need to change, which is why, we're looking at 2 lifetime doses that people need. It's not like the flu vaccine where you need to go back every year.
Because measles is the same every year, essentially the same thing? It doesn't
Yes, we don't need to
morph.
change the vaccine.
Gotcha. Okay. Let me read this. According to Public Health Ontario, October 2024, there was an exposure to, quote, a travel-related case in New Brunswick, ending up in hundreds of cases here. Okay. We've had travel-related cases of other things before, so why are we seeing this sort of outbreak now?
Yeah, it's such a great question. So the outbreak, we've got over 500 cases now associated with this outbreak. And really what we are seeing happening is because we have overall lower population measles vaccine coverage, that when the measles cases get into the community, they're not getting stopped. So what would happen before is you'd have someone who maybe traveled, brought it back into their community, but everybody around them was vaccinated. And so it kind of stopped there. It didn't spread any further. Whereas right now, we have some communities that have low vaccination rates. And so what happens is you get a case of measles in that community, and it's able to spread to one person, and then it spreads to the next person and the next person. So that's why we really need high vaccination rates as a population in order to break that chain of transmission and stop spread. I think, when we think about measles, one of the good things is we know what we need to do. We've eliminated this in 1998. So we know how to do this. We know how to watch for cases, and we know that the vaccine can prevent it. And we've got, a healthcare system that is set up to be able to give vaccines, especially in childhood. So I think this is, for anyone who wants to prevent it, now is really the time when you want to get in and make sure that your children's or your own vaccines are up to date.
Dumb question, but are the shots free?
The shots are free in Ontario, absolutely.
They are. So it's
Yeah.
like COVID, you could go,
You can go to your primary care provider to get vaccinated.
Pharmacies too, do they provide?
I don't believe pharmacies are providing this, although I'm not certain. You could check with your local pharmacy, but definitely routinely available through primary care.
Okay. Those 550 cases in the province of Ontario, geographically speaking, do you know where they are?
Geographically, they are in southwestern Ontario.
All of them?
Not all of them, no, but we're seeing cases across the province. And I think that's important for people to keep in mind is measles isn't about geography. It's not about gender. It's not, it can affect anyone who isn't immune. And so if you weren't born before 1970 and had measles, or you don't have the vaccines, you're going to be susceptible. So right now, that's where we're seeing the cases, but the risk exists across the province.
Is there a theory as to why southwestern Ontario would have a preponderance of the cases?
There's certainly anywhere that you are going to see lower rates of vaccine coverage is where you're going to see it. And there are some communities in Ontario that do have lower rates, and that's why we're seeing it there.
I'm really curious about you, in as much as, no doubt when you are doing your job for Public Health Ontario, you thought to yourself at some point, well, thankfully we don't have to worry about measles anymore because we got rid of this back in 1998, and yet here we are. Are you shocked?
Yeah, I mean, I never thought that I was going to see this kind of outbreak. Based on 1998, we had had high levels of vaccine coverage pre-pandemic. I knew we were going to see cases come in and maybe a little bit of spread within families with imported cases. But I didn't expect to see this. But, the part that I always hold with optimism is like we actually know how to fight this one. It's not like when I think back to 2020 and COVID, we didn't know a lot about the disease. With measles, it's been around for a long time. We know the disease well. We have the tools available for people to, basically prevent it through immunization. And so it really is literally, Ontarians, time to roll up our sleeves.
The difference is we've just been through COVID, and as a result, vaccine hesitancy. Some people don't like the idea of getting shots anymore. Some people think it's an infringement on their freedom. You've heard the long list of reasons why people don't want to do it. If we were at 86% once upon a time, which was a good number to be at, coverage, but we're only at 70% today, what do you think it's going to take to get us back up to that number?
So I think that one of the things that's actually happening at this time is there's large vaccination campaigns happening across the province, and particularly in those communities that are experiencing more measles outbreaks. So local public health units, healthcare providers in those areas really trying to get those numbers up. There is something called the Immunization of School Pupils Act in Ontario, and so public health units review the records for children in school every year to see whether or not they're up to date. And some parents who are listening may remember getting those letters from public health saying your child we don't have a record that they've received this vaccine. So it's a really good reminder. I mean, I work as a family doctor too, and I can say that most of the parents that I talk to actually do want to vaccinate their kids. It's just, I get it, life gets busy sometimes. And so I think at this moment, what we're really looking at is like, let's try and make this a priority in Ontario so that we can stop the outbreak and get things under control and get our numbers up again.
Okay, I hear you, but hesitancy or outright suspicion of the shot is not just life getting in the way. That's a decision that parents have made that for whatever reason, they are not necessarily there. So, I mean, I just remember doing all these kinds of interviews during COVID as well. Is there anything in particular that you can say to some people who are really dubious about the whole thing, about why it needs to get done?
Yeah. So in terms of the safety of the vaccine, it's proven to be safe. Measles can be a severe disease, and so I'd really encourage them, if you want the best protection for yourself and your family, get vaccinated. And I think look to credible sources. One of the things is there is a lot of misinformation that exists out there and disinformation. And so looking to credible sources of information, I would suggest look at immunize.ca is a great public resource for families. It's written in language that you can understand. It gives you other links. Public Health Agency of Canada, Public Health Ontario. Ours are a bit more technical, but again, will give you really quality information. Your local public health unit, your primary care provider. Talk to people who've spent a lot of time really looking into this and can answer your questions. And, I will say that's something I do in my family practice. When people come in with questions, we talk about it. That is part of the role of a healthcare provider to engage in that and make sure that people feel comfortable with the decisions they're making.
Who's behind immunize.ca?
Oh, I'd have to go look at who actually operates it.
It's not you guys.
It's not us. No,
Okay.
It's been around for a number of years, and there's a number of experts that I know who are involved in it, but it's got really high quality information on a wide variety of vaccine-related issues, including measles.
If we have 550 cases in the province of Ontario right now, do you know what the rest of Canada looks like, and are they suffering through this as well?
So right now, Ontario is seeing the most number of cases, but there are outbreaks happening in a number of provinces across Canada. I don't have the numbers with me, but the Public Health Agency of Canada website will report the numbers for all of Canada. But it is something that we need to think about as a nation. It is not just an Ontario issue.
And the States has got it too now.
The States has it as well.
Texas has, I think somebody died in Texas.
Yes, there have been 2 deaths.
Two deaths in Texas.
Yeah.
Do you feel like you're getting a handle on this? I know you're trying to get the message out that it's really up to us to make this thing go away, but do you feel like you're making progress?
Yeah, so I do think we're making progress. We're keeping a close eye on the numbers. Now, part of this is because the incubation period is longer, 21 days. It takes a bit of time for us to see whether or not the numbers are coming down. We are seeing some positive signs at this point in time, but we're not out of the woods yet. And so, again, this is something that can resurge if there's further spread in communities that are have lower rates of vaccination. So I wouldn't want us to become complacent at this point in time.
But not eradicated. What do? We eliminated. We eliminated back in 1998.
That's right.
Can we get back there?
Absolutely, we can. So right now, Canada still holds elimination status. We would lose elimination status if we have spread within Canada after 12 months. And so we've been having this outbreak now for about 6 months. I think we've got 6 months to get this really under control, to break all the chains of transmission in Canada, and we can hold on to our elimination status. But more important than that, I think we really want to protect people. Like, at the end of the day, I don't want to see people in hospital because of this. We've already had 42 people in hospital because of this outbreak. I don't want to see deaths associated with the outbreak like what they've seen in Texas. And so, if we want want to protect one another, and we get vaccinated, we'll bring the rates up. And yes, that'll give us maintaining measles elimination status, but more importantly, a healthy population.
And elimination status is significant because what?
So elimination status, I mean, essentially means we got rid of the disease. Like, how amazing is that when you get rid of an infectious disease? But elimination status is granted by the World Health Organization.
What do you okay, since you mentioned the WHO, what do you think about what the current U.S. government is doing in terms of its relationship with the WHO?
Yeah, I mean, I think from my perspective, I can't comment on the US government, but I think the World Health Organization plays a really important role globally in terms of providing us with awareness of diseases that are happening in other countries, helping to coordinate public health around the globe. You know, certainly Canada contributes through that through the international health regulations. So when there are infectious diseases in other countries that might come to Canada, we hear about those. We also share information about what's happening in Canada so that others will know. So I really see it as part of the kind of global public health ecosystem.
Clearly, the Americans no longer have confidence in the role that the WHO plays, and they certainly don't want to be funding it anymore. Does anybody in the province of Ontario in a position of authority share that view to the best of your knowledge?
So I wouldn't be the best person to ask about that question.
You're the only one who's here today, though.
I know. My colleagues at Public Health Agency of Canada who have the link to WHO would really be the ones who could speak to that.
Do you still have confidence in the WHO?
Absolutely, I do. Yeah, I think the WHO provides a lot of really helpful information. They do a lot of work, especially in low and middle income countries. And, you know, we live in a really global community. You can be anywhere within 24 hours. Diseases don't know borders, and so having an organization like the World Health Organization, which really convenes all of the nations around the globe to work together to improve health, I think that's a really important thing.
I mean, my suspicion is that there are a lot of people in this country who are paying attention to what's going on in the United States right now because there are lots of healthcare workers being laid off. The new Health and Human Services Secretary, Robert F. Kennedy Jr., has taken, let's call it, a novel approach to the health of his country. You're watching that, I imagine, with a great deal of fascination. What do you think's going on?
So I think, like many Canadians, I'm really watching what's happening in the U.S. You know, I think about things like, again, because we're a global community, things can pass across borders. So, you know, the things that I'm really concerned about is, can we keep an eye on the infectious diseases that are coming into Canada? I think we have a really robust system at this point in time to be able to do this. But certainly think about, you know, all of the information that is coming out of the US, much of which is inaccurate related to things like measles, and really wanting to make sure that we can give Canadians credible sources to look to. So that's what I'm really focused on. What can we do here in Ontario and in Canada to make sure that our public health system stays strong to protect everyone? I feel confident that here in Ontario that we are paying close attention to what's happening, and we're taking steps to prepare so that we can be prepared for diseases like measles and other vaccine preventable diseases that could come into Canada.
Last question. Could this thing just sort of die out on its own eventually?
Yeah, so, you know, I think that we don't want to wait to see if that's going to be the eventuality that will happen. I think we know how to stop this, and why would we not stop an infectious disease that harms people from spreading? So, you know, I think that if we can get our vaccination rates up, we can actually stop this a whole lot faster than if we were to just let this run in the community.
Gotcha. That's Dr. Jessica Hopkins from Public Health Ontario. We thank you for coming into TVO tonight.
Thank you.